Bruce Willis was one of those people who I would go see in any movie. I just liked watching his charisma on stage and on screen. And it was such a sad moment when I learned that he was diagnosed with frontotemporal dementia. I'm Richard Nahas, and this is the New Medicine Podcast, bringing blockage-based care to medicine. This is our first episode, so let me tell you who I am and what I'm here for. I'm a medical doctor who's been practicing in Canada and more recently in New York City for about 20 years. I started as an ER physician, and after 2 years of backpacking, became interested in traditional healing and integrative medicine. And after teaching, speaking, participating in research studies, and running a clinical practice, after leadership and advocacy roles, and having explored functional medicine, hormone medicine, regenerative medicine, homeopathic, Ayurvedic, chelation therapy, vitamins, herbs, detox, machines, lasers, frequencies, you name it, I have identified a really big idea. And I've established a few key insights that can help anyone who wants to get well do it more quickly and effectively. So let's start with blockage-based care. What is this and why does it matter? So let's declare a blockage hypothesis of disease. There's not enough evidence to call it a theory, like the germ theory, but the blockage hypothesis may be just as important. What it states, quite basically, is four simple things. One, that our injuries can create permanent scars in the nervous system and fascial network. Number two, that these scars can act as sources of electrical noise, disturbing the balance in the regulatory system as a whole and affecting how the immune system, the endocrine system, and even your thoughts and emotions manifest because of these points of stress creating inflammation, tension, and acting as what the Germans call disturbance fields. The third principle is that these lesions can be identified and treated in clinical practice, and that whether you use a local anesthetic to inject them, or use your hands, or an acupuncture needle, or a laser device, targeting these lesions can stimulate a healing response from the body. And number four, perhaps the most important, these lesions are palpable. And that means that any person can learn to find and release the hot spots in their physiology, the tension points in their anatomy. And this allows you to target your scars for self-care, and it allows your providers to target your scars for more effective, personalized, targeted treatment. So if the blockage hypothesis is correct, then treating blockages represents a historic medical advance. This is why I'm here, at your service and the service of all our brothers and sisters to come. Whether you're a medical doctor or a rehabilitation provider or a wellness practitioner, whether you're a person with an illness who's trying to get well or a person who's doing fine and trying to get better, learning about blockages can change your wellness journey. So click the buttons, like and subscribe, share it with your friends. Here you'll get a unique voice and a unique lens that will allow you to navigate the thousands of options you have when you're trying to get healthy. The second big idea that I'm bringing to you here in this podcast is a concept called rational prescribing. What does that mean? It means that if you've got a condition that you want to improve and you want to explore how holistic options can help you, you should try one thing at a time and try to measure where you're at the start and at the end of each trial to identify the things that work for you and build your personal self-care and wellness regimen one trial at a time. So, as the president of the North American Academy for Neurotherapy, I am required to tell you that this perspective is not new. Therapy that comes from Germany called neurotherapy was developed nearly a century ago. A doctor and a dentist, two brothers named Walter and Ferdinand Hunecke, first described these lesions they called Störfeld, interference fields. They taught lectures and workshops. They published papers. Their students traveled across Europe and to Latin America. And today there are thousands of doctors in dozens of countries who treat interference fields with injections of local anesthetics. They call this neurotherapy, and it's completely unknown in the English-speaking world, but I'm here to change that. So if you have a chronic health problem and you think that you need a new perspective, stay tuned and learn about how blockages are a paradigm shift in healthcare. So let's dive in. One of the things that is on everyone's mind is brain health. I know it's on my mind. And although neurotherapy and scars and injuries are not directly related to dementia, this is really the final common pathway that chronic stress and chronic inflammation are leading us as we think about our plans for the future. One of the things we need to do is protect our brains. So I'm compelled to mention Bruce Willis because, Bruce Willis was one of those people who I would go see in any movie. I just liked watching his charisma on stage and on screen. And it was such a sad moment when I learned that he was diagnosed with frontotemporal dementia. What I learned about this gentleman, doing some research into his background, was that as a young man, he had a stutter. And I did a search to see if stuttering is linked to dementia in any of the scientific journals that are in the database we call PubMed. Any peer-reviewed literature linking what they call neurogenic stuttering to degenerative brain disease later in life. And I found no mention of it. But the other interesting thing about Bruce Willis is that he worked as a private investigator before he auditioned for Moonlighting, where he played a private investigator. I read that he beat out over 3,000 other people for the role, so he was destined for that. Incidentally, he was born in Idar Oberstein in Germany. His parents were German and American, so he's another World War II baby. But frontotemporal dementia is, forgive the pun, a very hard way to die because it's one of the most aggressive of the dementias. It progresses very quickly compared to Alzheimer's, Lewy body dementia, or vascular dementia, any of the other causes of degenerative brain disease. And one of the things that is the hallmark of these diseases, this family of conditions, is the accumulation of these proteins. One is called beta amyloid, And it forms these sticky plaques in the brain that accumulate and seem to be linked to the severity of dementia. And this protein called tau, which forms what are called neurofibrillary tangles. So again, you have this debris that is accumulating in a brain because presumably there's an imbalance between the forces that create wastes and the systems that clean them up. So recognizing that this represents an imbalance between the forces that cause disease and the body's ability to heal itself, we look to mechanisms to try to understand why does this happen and ask ourselves how we can fix it. So very clearly it's linked to mitochondrial disease. It's linked to neuroinflammation. It's linked to an excess of oxidative stress in the brain. These are buzzwords that you can look up on your own time if you haven't heard them before, but they're the mechanisms that underlie so many of the chronic diseases. But in this case, they happen to target the function of the housekeeping cells in the brain called microglia. And this is important because microglia are felt to be key players in understanding how the brain shifts from a stress mode to a healing mode, from a pro-inflammatory state to an anti-inflammatory state. And that's very closely linked to the autonomic nervous system. And that's important because the autonomic nervous system is linked to stress and the fight or flight response. And we think that blockages, scars, wounds that persist in some cases after any injury or stress, whether it's a broken bone, a surgical wound, an animal bite, a recurrent infection, a sprain or strain, an injury that never fully healed for whatever reason, can become a focus of tension, inflammation, and stress. And the theory is that these points of noise, these disturbed circuits in the nervous system, contribute to a total load on an ongoing basis of what we call chronic sympathetic activation. So while there's no clear link between interference fields, between fractures, between these specific injuries and dementia, if the blockage hypothesis is correct, then treating our blockages represents a very good approach to improving brain health. And my mandate is to put numbers behind those claims, to measure outcomes in real people who are treating blockages and tracking their progress. But if you're interested in brain health, one of the questions you may be asking yourself is, how can I tell if I'm at risk of dementia, or how can I tell if I have it? And this is a big marketplace because right now there are PET scans that target the imaging of tau and amyloid. And these can be used to identify the total burden of tau and amyloid in your brain many years before you develop symptoms. So they might be a very helpful tool for early diagnosis. There's also a blood test called GFAP, glial fibrillary acidic protein. And measuring levels of serum GFAP may be another way to identify dementia years before you develop symptoms. But here's the thing, the focus on these proteins that collect in the brain, the waste products that seem to be associated with the progression of the disease, they may just be the forest for the trees. They may be a red herring completely, because the thing that causes dementia may have nothing to do with these proteins. It may be that the The underlying problems that cause dementia also cause the accumulation of these plaques and neurofibrillary tangles. So, although there's a lot of reason to be hopeful about the future treatment for dementia, it's so important for every person who wants to take ownership of their own health, take ownership of their life, to think about brain health as one of the most important priorities over the long term. Bruce Willis made some amazing films. Think about The Fifth Element, 12 Monkeys, Pulp Fiction, and Sixth Sense. Let's talk about the sixth sense, because this is something you're going to learn to use if you want to find and treat the blockages in your tissues. What is the sixth sense? What is this third eye that we talk about? What is the gut instinct? Woman's intuition? Is this a real thing, or is this just nonsense? Well, the National Institutes of Health has decided to make interoception a research priority. Interoception is the scientific term used to describe your ability to feel what's going on in your body. And most of our senses are focused on the external environment, perception of touch, sight, sound, smell, and taste. But interoception, the sixth sense that we can use to find the places where we're stuck, that we can use to guide our decisions, the inner compass that we can use to connect to our autonomic nervous system, is in fact a sixth sense. So at any moment, your body is either in a state of rest or in a state of what we might call vigilance or stress. You're either paying attention to something in your external environment because you perceive something of interest, either a threat or something you might want or need. And if you're not paying attention to something and either striving for something, if you're not moving towards or moving away from, you are at rest, you are relaxing. And this shift between yin and yang is a shift between focusing on your internal milieu and focusing on an external threat. And this shift between yin and yang is something that occurs in all living things. It's one of the basic principles of life that governs your nervous system, and it governs how a single-celled organism will survive in the primordial sea, either focusing on homeostasis in the yin state, or reacting to something that it perceives as significant or relevant, either desirable or a threat. Neurotherapy, blockage-based care, is based on the theory that you have some parts of you that are much more vulnerable to being triggered, to triggering a shift in your body from the rest state to the stress state. And learning to recognize when you have shifted from rest into stress allows you to use that as an inner compass, guiding your thoughts, your decisions, your choices throughout the day. And certainly the way we use this principle in neurotherapy is we recognize that these scars can trigger a stress response. And, you know, fascinatingly, the third eye has been described for millennia. And what we now recognize is that the stress response is coordinated by a part of you that's called the HPA axis, the hypothalamic pituitary adrenal axis, that triggers the stress response and releases a cascade of hormones and impulses in the nervous system to help you respond to that stress response. And where is the hypothalamus? Well, it's located at the base of the sphenoid bone, right in the middle of the skull, in what you might consider the third eye. So is this the third eye? Can we say this for sure? I'm just a man interpreting the traditions I've studied in my travels around the world. But what I recognize is that in my clinical practice, I've developed tools that allow me to use touch to identify what triggers a stress response. In the same way that other practitioners may use muscle testing or pulse testing or other techniques, this is something that has been overlooked by evidence-based medicine. This is something that is not validated by any scientific evidence at this time. Not in a direct manner, anyway. But there is a large body of evidence, which we'll explore in the episodes to come, that suggest that we can identify the things that trigger stress. And we can use objective scientific instruments, shear wave elastography to measure tissue tension, pulse waveform analysis to measure sympathetic tone in the walls of arteries, EEG changes in real time to look at the stress response in the brain, so that there's an opportunity to validate this theory that our scars trigger stress. In the meantime, there are a lot of great books written about intuition and that sixth sense. And if you're a wellness seeker, that's a fruitful path for you to dive into. The interesting thing about stuttering is that it has been closely linked to a part of the brain called the superior longitudinal fasciculus. It's a little part of the brain that links different lobes on one side. And stuttering has been linked to this part of the brain because it integrates the part of you that decides what you want to say and the part of you that moves your lips and your throat and your vocal cords. So the thinking part and the moving motor part of the speech process. And as coincidence, perhaps not, frontotemporal dementia is also closely linked to this part of the brain. Now, some people would assume that stuttering is a result of emotional trauma, but there's really no evidence of this. It appears to be a neurodevelopmental disorder that kids are born with. In most cases, it appears in early childhood, and it persists in more males than females, so that the adult prevalence is about 1% in mostly men. And this occurs around the world. And it's been linked to about 50 different genes. And the notion that we have weak spots that we might inherit, and that those weak spots that might cause stuttering in childhood should be taken note of and perhaps targeted, even if the stuttering goes away, recognizing that maybe you'd be more vulnerable to a brain disease later in life because you have some fried circuits affecting brain function. The wellness solution we'll talk about today is astaxanthin. Let me frame the wellness solutions segment of our show. Natural health products are just one of many wellness solutions that people consider when they're trying to get well. Whether it's a herb, a vitamin, a fat, an oil, an extract, If it comes in a pill, we call it a natural health product. This also includes some topical ointments, homeopathic drops, etc. But wellness solutions also include acupuncturists, massage therapists, physical therapists, chiropractors, hypnosis providers, Reiki practitioners, therapists, counselors. Any provider who delivers a service, that intervention is something that may or may not help you. And your journey is all about finding the interventions that work for you, because we're all different. And the only way to pursue personalized, evidence-based medicine is to make yourself the subject of an N-of-1 trial. And of course, we all need to embrace the insights that we get from evidence-based medicine, large clinical trials that tell us that if you take 5,000 people and you give half of them intervention A and half of them a placebo, the half that got intervention A overall did better than the half that got placebo. Does that mean that intervention A is going to work for you? Not necessarily. So while clinical trials do represent important sources of evidence, when you're on a wellness journey that is focused on an N of 1, what really matters is what works for you. So in some cases, you can decide for yourself whether a symptom or a problem responded to an intervention, whether your headaches are better, whether you're sleeping more soundly, whether your bowel movements are more regular. These are things that you're entitled to have an opinion on. But when it comes to something like brain health, you may need to work with an expert, because the only way you can tell if something is working is by identifying something that you want to measure. It might be a symptom, it might be a blood test, or an imaging report. And you need to be clear about what you're trying to improve. That's what we call rational prescribing. But we're going to start with something that is maybe not the easiest thing to gauge from a rational prescribing perspective, but what the heck? Let's start with caviar. Not necessarily the classic sort of black sturgeon caviar, but salmon roe. The red caviar that is super rich in a carotenoid called astaxanthin. Carotenoid sounds like carrot, a family of chemicals that makes fruits and vegetables look yellow, orange, red in that spectrum. And the carotenoids include vitamin E, also called alpha tocopherol, and other carotenoids with names like lutein and zeaxanthin and astaxanthin, beta tocopherol, gamma tocopherol, and they all bind to one receptor. And that's why multivitamins are dangerous. You heard that correctly. Many studies have suggested that people who take multivitamins have somewhat of an increased risk of heart disease and cancer. Now, why would that be? Well, one of the hypotheses is that because most multivitamins contain a lot of vitamin E in the form of alpha tocopherol, this saturates the receptor and prevents the body from absorbing the other members of the carotenoid family, which may be more potent and important in terms of healing the immune system. So if you take a vitamin E supplement every day, you may be preventing yourself from absorbing the good medicines in the fruits and vegetables that we all evolved to be nourished and healed by. So astaxanthin happens to be red. And the reason that it's so rich in salmon roe is that salmon eat krill. And krill eat microalgae, a very specific species of microalgae called Hematococcus pluvialis. And under conditions of stress, this little algae, this single-celled organism, turns from green to red. It produces a pigment called astaxanthin, which is a very potent quencher of reactive oxygen species. Very powerful anti-inflammatory, one of the most powerful in nature. So this is one of the reasons why it's a good idea to eat salmon. Incidentally, farmed salmon is rarely as naturally pink as astaxanthin, so it's often colored with an artificial pigment to make it look like a natural, healthy fish. Probably better to eat wild salmon, about 2 to 3 milligrams per serving. You can also find astaxanthin in tiger prawns. Those red-colored triangular zigzags on the back of a tiger prawn are pigmented with astaxanthin, another 5 to 10 milligrams per serving. But salmon roe contain about 100 milligrams per 100-gram serving. So whether you put your caviar on cream cheese or a biscuit, whether you eat it as an appetizer or have it with sushi, it may be a good idea to introduce some salmon roe to your diet for a brain healthy, elegant afternoon tea. And you can also get astaxanthin in capsule form, obviously. In most cases, it's derived from the microalgae that produces it. So very low on the food chain, very sustainably harvested. And a trial of astaxanthin may be worthwhile for anywhere from 2 to 3 months to see if what we would call brain health improves. Maybe you're trying to improve ADHD. Maybe you're struggling with depression or anxiety. Maybe you're having problems with cognitive function, or maybe you've had a concussion. Maybe you've got memory problems and you're struggling at school. Whatever the reason, you can assume that all of these symptoms, whether they fall under the category of neurology or psychiatry or learning disorder, they all reflect brain health. They reflect the health of this organ that regulates everything else about you. So this is the final common pathway for any disturbance in your system. And there are many anti-inflammatory, antioxidant, reactive oxygen species targeting remedies that you could take. But I think it's important to integrate food as medicine whenever possible. And I think that astaxanthin is one of these really interesting, fundamentally important, potentially powerful interventions that deserves more attention. There have been some preliminary studies linking astaxanthin to improvements in cognitive function in human studies and animal models of dementia. And it may end up being the case that improving the health of the immune system of the brain by targeting inflammation is the best way to protect the brain from dementia in the long term. Whether you're treating your blockages or not, finding the supplements that you think make the most difference for you is one of the goals you have to pursue. So put astaxanthin on the list and give it a spin. And compare it to all of the other things that you might try, which we'll review on this podcast one at a time, to give you the information that you need to make the right decisions about what to take and how to take it, and how to decide what works for you. With that, we'll wrap up today's episode and say thank you for joining us. And please share this with anyone who might need it. And plan to follow this over the long term, because the story of blockages is not a simple story to tell, but you heard it here first. This will change healthcare. See you next time.